And so we're going to pivot now to find out what's being done to support new mothers and their families. So it's a delight to introduce Dawn Levinson, who is the go-to person within Health and Human Services for perinatal mental health. Dawn is the Deputy Director, Division of Healthy Start and Perinatal Services within the Maternal and Child Health Bureau within HRSA. Dawn, thank you for joining us today, and thank you for your continued work on behalf of MCHB and HRSA in implementing the important programs that you're going to be speaking about. So please take it away.
Adrienne, thank you so much. Thank you for the kind introduction. Hopefully folks can hear me. Again, I'm Dawn Levinson in HRSA's Maternal and Child Health Bureau. I'm, in addition to the Deputy Director for the Division of Healthy Start and Perinatal Services, also the Behavioral Health Lead within MCHB. So I'm very pleased to be sharing with you today our key investments in supporting maternal behavioral health. And I hope that you walk away from the brief remarks here with some knowledge of some MCHB resources that can support your work in promoting maternal behavioral health, whether you work at the national, state, or community-based level. Next slide, please. So MCHB's programs fundamentally promote mental health and well-being for maternal and child populations across the lifespan. And our work supports the principle that there is no health without mental health. MCHB recently launched a new strategic plan that will guide our work over the next 10 to 15 years. That plan sets out 4 goals that support our mission to improve the health and well-being of our nation's mothers, children, and families. That's access, equity, capacity, and impact. The first goal is access. Assuring access to high quality and equitable services has always been central to our mission. We strengthen access to behavioral health prevention and treatment by, by linking women and families to treatment and supports through screening, referral, direct service, and telehealth, providing patient-centered, culturally and linguistically appropriate and community-based services that address social and structural determinants of health, and strengthening state and community-based comprehensive systems of care for MCH populations. For example, states have used their Title V MCH Services Block Grant to support access to behavioral health care based on the priorities that they identify. States have used block grant funds to lead trainings to promote screening and referral for mental and substance use disorders among maternity care providers. They used funds to implement QI projects with providers, to coordinate across state agencies and providers, to implement culturally appropriate peer support services for high-risk pregnant women, and more activities. The next goal is equity. We are amplifying our efforts to advance health equity in all of our programs. To address health inequities, among other actions, we're expanding support for the programs that we know make a difference. For example, increasing community-based doulas in Healthy Start communities, where the infant mortality rate is 1.5 times the national average. By working with women during pregnancy and after giving birth, including screening for depression and interpersonal violence, and linking to services, Healthy Start helps reduce racial and ethnic disparities in infant death and severe maternal illness. The third goal is capacity. That includes expanding training opportunities and increasing the diversity of professionals and community-based workers. And I'll expand on 2 of those programs in the next couple of slides. Our fourth goal is impact, which comes from communicating our work to the field in forums like this one, partnering with key stakeholders, and consistently monitoring our performance data so that we can continue to improve. Given that our time is short, I will quickly highlight 3 investments in the perinatal behavioral health space more closely. Next slide, please. So this slide actually illustrates something that we heard Administrator Johnson speak to about the screening and treatment for maternal depression and related behavioral disorders. And you can see the 7 states there. So if you are a primary care provider serving perinatal women in one of these 7 states listed here, this service is for you, providing provider training, real-time psychiatric consultation, and care coordination support. Next slide, please. Also, to improve capacity through the Alliance for Innovation on Maternal Health, or AIM, MCHB supports the development and uptake of maternal safety bundles in U.S. hospitals and birthing facilities to reduce preventable severe maternal illness and deaths. Safety bundles are sets of evidence-based practices. In 2021, AIM released a new safety bundle called Care for Pregnant and Postpartum People with Substance Use Disorder. This bundle guides providers to support people experiencing substance use disorder to optimize patient and family health and prevent related severe maternal morbidity and mortality, including overdose. To download this safety bundle or any other for use in your hospital or birthing facility, please go to safehealthcareforeverywoman.org/AIM. Next slide, please. So you've already heard great excitement about the new National Maternal Mental Health Hotline this year that HRSA launched for Mother's Day. And I want to acknowledge that many of you participating today have been very instrumental policy advocates in helping to make this critical service a reality for new moms. So as you've heard, the hotline provides 24/7 free confidential support, resources, and referrals to any pregnant and postpartum moms facing mental health challenges or their partners and providers. Professional counselors staff the hotline, providing support in English and in Spanish, along with translation services in up to 60 languages. HRSA contracts with Postpartum Support International, or PSI, a leader in perinatal mental health support, to operate and maintain the hotline. So you can see on the slide, to reach the hotline, please call or text 1-833-9-HELP for moms. Okay, next slide, please. Okay, and so this is my contact information along with MCHB's webpage on behavioral health. I hope that as you all participate in today's Prevention Summit, that you can join MCHB in our critical efforts to improve access, equity, capacity, and impact. We all have a role to play in the well-being of mothers and infants, and I hope that knowledge of some of these resources will help you further your efforts. And please connect with HRSA on one of our 4 social media platforms. Thank you so much.
Thank you, Dawn. You are our hero. You are our go-to person. You are our champion within HRSA, and we are so grateful for all the work that you've done in supporting those programs.